Hey everybody, Eric Christensen from Chandler Physical Therapy here. I wanted to talk a little bit today about shoulder impingement, which is one of the most common things that we will see when people come in with shoulder pain or shoulder dysfunction. And shoulder impingement is kind of a catch-all for just generic shoulder pain. It doesn't really say what's going on, it's just saying that something dysfunctional is happening within the shoulder joint to cause a pinching of the tissue around it. And that's exactly what we find a lot of the times. This can lead to rotator cuff repairs. This can lead to, rotator cuff tears, labral pathologies, tendinitises if left unchecked or untreated. One of the things that we see a lot of, if we take this shoulder joint here, here's your shoulder blade. This is the top of your arm here. If we turn it kind of like this, here's your collarbone. So it would sit kind of like this on me. One of the main things that we'll see is that this shoulder capsule, this big kind of pink thing here, gets very, very tight. And whether that's from injury or whether that's from repeated disuse or posture, we see that it gets very, very tight. And if that gets tight, the shoulder that normally moves very well within the joint suddenly becomes limited in what motions it can do. Particularly if we were to take this and reach overhead, the shoulder has to rotate around. Okay, if it does it cleanly, we don't have any issues here, but a lot of times the bottom part of the shoulder capsule and the back part of the shoulder capsule get tight, which limit the ability of the shoulder to go down or back. And instead of rotating cleanly within the joint, we see it pivot and pinch up underneath this thing we call the acromion. That repeated pinching becomes very much of an issue and creates a tendinitis here either on the bicep tendon, the supraspinatus tendon, or other areas. So if you think you have shoulder pain, shoulder impingement, come get it checked out. Get it checked out by a licensed physical therapist today.